Welcome everyone to another wonderful episode here, Doctors of Podiatry. We're here in our office-based surgical suite. We're here today with our very own, our partner in crime, Dr. Orlando Nunez. This is a really special case. I'm going to try to keep it brief. There's a condition that's called a Brachymetatarsia. We have definitely spoken about before. We're going to keep this one very simple. The condition, usually congenital in nature. The metatarsal itself, right? We have 5 metatarsals. The 4th one, historically, the most commonly, this is where we see brachymetatarsia the most. The metatarsal doesn't grow fully like the other ones do. So instead of maybe growing 100%, it only grows maybe 50%. And what happens is you guys are going to go ahead and see, what the clinical presentation looks like. And he's he's 30 years old. He's been very unhappy for a very long time with the appearance of the toe. So this is the fine example of finding beauty in function. Believe it or not, he is embarrassed. His self-esteem has been affected. So what we're going to go ahead and do, this is kind of like a very, it's just a phenomenal case. The before and after transformation, it's going to be wonderful. So as everyone can see, the 4th toe is very short. Right? Looks like a little sausage that's kind of just sticking out of the foot, right? So there's several things that we want to do. Let me put some weight on this here, kind of like that. That's what the foot normally, we'll say, looks like, right? So what we want to basically do is we're going to move this guy over a little bit, right? Create a little bit of more space. Bring this toe down. Can you see there? And then we're going to shorten this guy, and maybe this guy a tiny little bit, maybe. So it's gonna sort of look like that. That's what we're looking for, right? Like that. When you talk about intricate, delicate, and fragile procedure, this is it. And I'll tell you why. The alternative, the reason why a lot of people may say, well, why don't you just correct the actual, the metatarsal and lengthen it? Problem is that the patient doesn't want that procedure. We spoke about it. It's a very long and rigorous recovery. So he has elected to something a little bit more simple. So it's a different, instead of working in a, Caesar, stay here with me. Instead of working, we'll say in a straight line, right? Just applying what we call the little gadget on the top of the foot. We're doing it kind of maybe backwards, right? In a sense, we're fixing everything around to give him exactly what he's seeking. And what I was talking with Dr. Nunez is that I think that we're going to be able to achieve actually a more, from an aesthetic standpoint, something a little bit nicer with no internal fixation. Patient, we're here in our office-based surgical suite. Patient's wide awake right behind me. And this is going to be a home run. I'm going to put the video on standby for now. We're going to get to work. Excuse me. And then at the end, we're going to show what, we'll edit another little clip, okay? So everyone, stand by. Okay, so I'm trying to get everyone into the action here. So I'm going to be at the helm today. We have Dr. Nunez. I'm going to be narrating some of it. 1 second. Okay, so come around. The first thing that we want to do is go ahead. I'm going to release some of the soft tissue structures. Again, we're dropping the 4th toe.
We get inside the joint.
Okay. We want to release around the joint. There are some very important structures that we want to release. That's exactly what we're doing first. You guys have to remember that this toe has been like this for 30 or minus 30 years, but I've always said that these toes have a mind of their own. Okay, now watch this. Boom. Oh, we'll see. I think the patient is a little bit, he's a little bit stunned. Okay, come around. Okay, so the toe now is down. Okay. So now we're gonna work on toe number 5 and toe number 3. Okay, let's put a standby to this and then we'll continue to show a little bit. Okay, everyone, so we're essentially done. This was a really, really fun and challenging case, to say the least. Come around. So, as everyone, Caesar, try to get more. There we go. Perfect. Okay, so total of 3 procedures. We shortened toe number 5. We lowered toe number 4. And we decided, and you guys will be able to compare the before and the after in respect to the 3rd. We also decided to do a toe tuck here. Let me see if I can get the foot to kind of move a little bit this way. There we go. To give the toe, it was extremely, he had a big pocket of adipose tissue, fatty tissue there. So that's gonna really contract really nicely. And we're gonna keep this toe just like that, compressed. This will go down. And as you guys can see, we have achieved what used to be, right, something to the best of our abilities, of course. We're not magicians, but we have achieved that happy place between beauty and function. The patient is wide awake. The patient is extremely happy with the results. You know, that's kind of like the nice thing about, you know, these procedures. The patient, we're able to make intraoperative decisions as we move along. A little bit shorter. Do you want it like this? How about like this? And we're able to get that feedback, which is really important, especially when we're comparing the left and the right foot. This particular case, it was only a unilateral, only the left foot. But I want to give another, just show everyone, right? We almost decided to shorten the second a little bit, but we said no, right? We have achieved exactly what we wanted to do. And I think the patient's going to be extremely happy. We can always, right? We can always, if the patient decides in the future to have something else done, like shorten the second toe maybe a little bit, we can always do that. And that's the beauty of these minimally invasive anesthetic foot and ankle surgical techniques. So I want to take this opportunity to thank several people. As always, Lisbeth, thank you. Caesar, for the wonderful photography. Dr. Orlando Nunez, okay. Absolutely wonderful human being, and I really mean that. So I want everyone, as always, and I will continue to put it out there, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. In addition, I want to give out a plug to, of course, Dr. Orlando Nunez. You like that, huh? Instagram, CDA foot, ¿cómo es?
CDA foot ankle.
CDA foot ankle. Follow him.
And www.cdafootankle.com.
Okay. He's in Idaho, believe it or not, and he owns the West Coast. Does anyone would like to say anything else, Dr. Nunez? Anything? Anyone? Patients? Let's get a quick video sort of testimony. Don't look over there. How did it go?
Good. I like it.
Was it painful? Not painful? Was it a good experience?
Yeah.
Okay,
Good.
super. If for all the people out there, what would you say? ¿Qué le diría?
I'm impressed with the work. It's look professional, nice. I like it.
There you have it. The patient doesn't lie. Ladies and gentlemen, please do your homework. Always. Not all surgeons are created equal. If you, for anyone out there in this world seeking MIS, minimally invasive surgical techniques, do your homework. Extremely important. Have a wonderful day, everyone. Okay, so just wanted to give everyone just the final take, final outcome, using special splinting techniques. As everyone can see, toes are nicely compressed. Fourth toe is definitely down, and of course we have the there we go. That'll give everyone a better. So there everyone can see again how we were able to basically just bring down the fourth, compress the fifth, shorten the fifth, and then we just did a little toe tuck here to bring a little bit of more symmetry in comparison, obviously, left to right. I was just talking to the patient. We're extremely thrilled with the outcome. This is considered a reconstructive case bearing some of the variables, right? That, to be specific, that the patient did not want. Because of A, B, C, and D, we weren't able to, like I said at the beginning of this video, we weren't able to use a little device. It's a technique that we call callus distraction to actually lengthen the metatarsal back to its normal anatomical position. So, you know, we worked with what we had, and it was a true joy. It really was. Really great. Smiling. This is the first case that we've done in respect to the brachymetatarsia and only doing soft tissue and bone procedures, specifically the fourth and the fifth. I'm sorry, the third and the fifth, and I think it was a huge success. So we're extremely happy. We're done. On to the next.
Tiene la tijerita por ahí.
La tijerita.
La tiene.
¿Quién tendrá la tijerita?
Sorry.